Alrighty, welcome everybody. We are live and we're incredibly excited to be joined by Dr. Kirk Gair for a Facebook live session today for Fix. We're talking about the topic of could non-thermal light laser by therapy by electromagnetic energy transfer be a legal performance enhancer to help athletes not only perform better, but recover faster and heal with injuries up to 25 to 35% quicker rate. Dr. Gair has been using low level non-thermal lasers since about 2004 and has worked with a series of champions from Super Bowl champion players, World Series champions, Olympic gold medalists, and record world holders, national and state champions, and as well as your weekend warriors. The techniques he's pioneered have earned him a reputation as the Voodoo Doctor, and because of how fast and effective his athletes are responding to care, and non-injured athletes are regularly coming to him for performance enhancement as well. He teaches doctors from around the world in webinars as well as seminars in groundbreaking methods that he uses himself and has been featured in Dr. Isabel Wentz's documentary, The Thyroid Secret, as well as her New York Times best-selling book, Hashimoto's Protocol, for low laser therapy methods that he has created himself to help patients suffering with thyroid symptoms like brain fog and fatigue. He is regularly featured as an expert in online summits and master classes, as well as many popular podcasts where he shares how laser can be used to support conditions ranging from sports performance enhancements and recovery, concussion support, post-surgical rehab, anti-aging, and even singing enhancement and more. So he has been teaching laser therapy to doctors since 2017 online and with live 2-day seminars. And his patients fly in from around the world to see him at his clinic in South Carolina. He has published research in medical journals and is the principal investigator of a brand new type of laser technology. We are live today. I'm Chanel from the Marketing Commission. And if you have any questions or comments, feel free to pop them in the comment section and we will give Dr. Gair time to answer those for you. So with that very impressive resume, I'm going to hand over to Dr. Kirk Gair.
Great, thank you for that intro, Chanel, and thank you to everybody on the webinar today. I'm excited to share this info with you. Got a lot to share in a short period of time, so I'm going to jump in right now from the start.
Perfect.
So, as Chanel said, I've worked with a lot of top-level athletes, and I started off working with youth athletes, but as the word spread around of what we were able to do with lasers, not only for injury recovery, but also performance enhancement, I got invited, as you can see in this picture here. I'm with the Los Angeles Dodgers and the Los Angeles Angels here for their fantasy camp. And I got to work with some of the greats from those two organizations that had been there for, when they won their championships in the 1980s and in the 2000s. And they asked me to come out there to introduce these low-level laser methods to not only the pro athletes that are retired, but also to the campers and to the trainers who were there. So when I first showed up and I brought out my laser, so one of the trainers who'd been the head trainer for the Dodgers organization for 25 years looked at my laser and he's like, "Oh, what do you got there, Doc? What kind of voodoo is that?" Because he was still doing the same kind of things that was done when I was a college athlete back 30 some years ago in the 1980s. And not to knock those therapies, but there are also some new ones that can enhance things. So initially, as they're kind of teasing me about what I was using, the tide turned when by the middle of the week, as I was getting people back out there who thought they were done for the week because of hamstring pulls or because of a wrist injury from batting a ball or a shoulder injury from throwing, I'm using a laser on them and getting them not only out of pain, but getting them back out there, and then many times to where they're performing even better than the injury was. All of a sudden, it went from those trainers having a line of athletes to see them to where I had an hour-long line in the morning, an hour-long line at lunch, and an hour-long line at dinner time for the athletes coming to see me because of the enhancement they got with all of their different performance metrics, like being able to bat a ball or how fast they could throw a ball. So word really spread around the camp, and it was great to see the changes in these athletes, especially ones who are such high-level athletes. And so this is things that you can do with your athletes. You can use your existing technologies and add laser on top of it and get an enhanced result. And I want to share with you some case studies that I have. So this particular athlete here, he went down and won a gold medal at the Pan Am Games, at the Pan Am Junior Games in 2017. And this is his story. So it gives you an idea. I like to jump right in with stories to share with you. So this is Zach Shinnick, and my practice, I'm near Los Angeles, California, and he now goes to University of Southern California. He's a Trojan over there. He came in to see me when he was in high school, and Zach had been plagued with chronic hamstring strains throughout his career that would sideline him often. His mom is a physical therapist, and he had also gone to other doctors, other chiropractors, gotten great treatments, but he'd always get the same injury that would come up. So what we did different with the lasers, and I'm going to show you some demonstration videos, is we went through and we did what I like to call neuro recalibration, to where we basically reset his nervous system with the laser, because Zach had some balance issues. He's an elite athlete. He was the fastest runner in the United States of a teen runner in 2017. Yet if I had him close his eyes and stand with his feet together, he would wobble all over the place. And if I put him into a heel to toe position, it was the same thing. He'd wobble. So this problem in the communication between his cerebellum and his muscles and the way it was affecting his proprioceptors was leading to this chronic hamstring strain. That's why the traditional physical therapy and chiropractic treatments were not working for him. So what we did with Zach is we went through and we did some transcranial or some brain laser therapy, which I'll show you how that works. We did some things with neck movements, with his upper body and with his lower body to find where the weak muscles were. And then when they're weak, to use the laser in a way to activate them neurologically. And that made a huge change with him that not only got him back out there, but where he thought he was going to have to skip his senior season in high school. Instead, we got him back out there, and he won a championship for his league, a championship for his conference, a state championship, and a national championship, where he ran the 8th fastest time in U.S. history. And the great thing is, after we did the laser, Zach actually ran faster than he ever had. And he was interviewed on TV asking about that. Hey, Zach, why do you think you're running faster than ever before? And it was the laser that made the big difference for him. And so Zach will still come in even when he's at the University of Southern California, and we'll do laser tune-ups on him to keep him at his peak. And he's gone throughout his college career without an aggravation of that hamstring injury, which is pretty amazing to have happen when it was chronic beforehand. And his team, they set a world record for the 4x400 meters, and they've broken it a few more times since then as well. So I have some videos to show you exactly how that happens. But before that goes, I want to share with you this study. You might even want to take a picture of this or a screenshot. This is a study that supports, because I love sharing case studies, but I always am a skeptic myself, and I ask, well, that's great, but are there any studies to support it? And this study from the Journal of Biophotonics in 2016 said for photobiomodulation in human muscle tissue, is it an advantage in sports performance? And so basically what this study found is that if you used lasers before or after exercise or sports performance, that it actually enhanced their performance. The metrics they used was to see how long it took them to fatigue, what was the number of repetitions they could do, how much torque did they have, and what was the muscle mass, what was their hypertrophy, what was the growth. They also would do lab tests to see what their creatine kinase levels were. And what they found was that laser increased muscle mass gained after training. It decreased inflammation and oxidative stress, and it improved their time to fatigue, the number of repetitions they could do, and also the torque of their muscles. The big thing for me that I love in this, and this is what I share with my athletes and with my coaches and my trainers, I'm like, hey, check this out. In this study, if you read the conclusion, they said, we raised the question of whether lasers should be permitted in athletic competition by international regulatory authorities because it seemed to give the lasered athletes an unfair advantage. If you read the whole study, they said that the results that were attained with these athletes through laser was similar to when they take performance-enhancing drugs. But now the fantastic thing about using a laser is it is not illegal. It does not have side effects at all. So you get performance enhancement without any kind of risks to the athlete, either for their body or for them being disqualified. So that's a great thing. And that's why I use it on athletes all the time. Now, before we get into the case studies and show some demos, there are some important things to understand, because many times when we talk about laser, not all lasers are created equal. Not all light therapy devices are created equal. Also, you have different devices for different conditions. So I want you to understand this, because as we're talking about the lasers that I've used for 17 years, the Erchonia lasers, they are in the visible spectrum. They range from 405 nanometers to 635 nanometers. So a lot of people will look at that and they'll say, well, those are great, but they don't penetrate that deep. Don't I need deeper penetration to get the best results? That's a big kind of story that's going around. But I want you to see this. So here in the US, our regulating agency is called the FDA, and they're the ones who will grant clearance for lasers to be used. And these Erchonia lasers, there are 21 total clearances for lasers, and the Erchonia ones have 18 clearances because they've been shown to be effective for chronic neck and low back pain, chronic plantar fasciitis and heel pain, chronic shoulder pain, all these different types of conditions. And in that, what they found was that the depth of penetration isn't really what dictated the effects on there, because particularly when we look at, we have one laser, the EVRL, which is one of my favorites. It's the handheld laser that has a violet and a red combination to it. The 405 nanometer laser only penetrates 1/10 of a millimeter, yet it showed clinically significant differences for acne, for nail fungus, and also for increasing the range of motion and decreasing pain levels in a single session. And they actually compared that violet and red combination to a red alone and found the violet and red got a better result, a faster reduction in pain and a better improvement of range of motion. And that's with a laser that doesn't penetrate very deeply. So penetration doesn't necessarily mean you get a better effect, because let's take a look at it. These lower wavelengths actually have higher energy. So when we're talking about 405 to 635 nanometers, there's actually more energy in that wavelength. And if you go even lower, you go into the X-ray realm, where it's even lower nanometers and even higher energy. And if you go to the other spectrum, so a lot of people like to use infrared, and I'm not knocking those, they just have different types of effects. Infrared, and then you can go far infrared, and if you go further out, it's radio waves. They have a higher nanometer, but lower energy on there. So let's look at what does that mean for what kind of things you're trying to achieve with a laser. So this was a study in biomedical research, and here they wanted to see how laser impacted testosterone levels in rats, and they actually put the laser on the cranium and then did blood tests to test these rats to see if they increased their testosterone. And we know that testosterone can affect sports performance, and you don't want to dope with it, but here's a way you can naturally increase it to enhance sports performance, even with older athletes. So they compared a deeper penetrating laser, an 808 nanometer laser, to a shallower penetrating laser, a visible red 670 nanometer. And they found that with the deeper penetrating laser, you got no increase in serum testosterone, but with the laser that didn't penetrate as deep, you got a change in serum testosterone. So that can also help an athlete's performance theoretically. Now let's look at nitric oxide. We know nitric oxide can be popular for athletes. Out here in the United States, a lot of athletes will take things called like NO Explode to try to increase blood flow to their muscles, to increase their endurance or their workouts to get stronger. This one again compared an infrared laser and a visible red laser, and they found the same thing, that yes, the infrared penetrated deeper, but it had no impact on nitric oxide. Whereas the visible red 660 nanometer laser didn't penetrate as deeply, but you got this nitric oxide change. So I love using this for athletes like Zach, to where if I know I can do things to stimulate his own body's production of testosterone, his own body's production of nitric oxide, we can enhance his sports performance in a way that is safe and that is legal as well. Now, as we're looking at this, many times doctors and therapists will say, okay, well, great, there's a laser, but I've heard LEDs are just as good and they're a fraction of the cost. So this is a great study. Again, you might want to take a picture of this and look this up for yourself. This is a review of the literature that compared true lasers to LEDs for sports performance, for a specific thing of sports performance. The key takeaway here was, as they did the review of the studies, they found that LEDs showed no objective clinical improvements compared to a placebo. However, when they looked at athletes who had actual true lasers, they had, again, like the previous study, improvements in the number of reps. They had less exhaustion, less lactate in their blood tests, and they had increased torque as well. And so we see that especially athletes that are doing a lot of competitions or year-round performances, this helps them with staying healthy and recovering from the stress of all these types of events. Now, let's go over here. Let me go back to this real quick. A significant thing here too, as I mentioned before, that Erchonia has all these FDA clearances, which allow a device to actually be marketed for certain treatments. When they got all of those clearances and they did their studies for chronic low back pain or for plantar fasciitis or chronic neck and shoulder pain, the placebo devices were LED devices. So they have direct head-to-head comparisons. And it showed that, yes, the LEDs did have an impact, but in many of the studies, it was only about, say, 10% of what the true laser was. So it's something to think about. You can get an impact with an LED, but according to these research studies and to these FDA clearances, it is not as much as a true laser. Now, what's also popular are the high-powered thermal lasers, the class 4 lasers. And we're talking today about low-powered non-thermal lasers. So I want to show you, this is a study in the Journal of Athletic Training comparing performance and exercise recovery if you used a high-powered continuous wave laser or if you used a low-powered pulse laser. And in this study, they found that there was no improvement for sports performance with the high-powered laser. And they actually found that it increased creatine kinase levels, where they said it may actually be creating some muscle damage in these athletes when you use a high-powered device to try to enhance performance. Conversely, when they used the low-powered device, like the ones we're talking about from Erchonia, you had more maximum voluntary contraction of the muscles, less delayed onset muscle soreness, and then you had changes on the labs as well, creatine kinase. So this again showed that for sports performance, these lower-powered devices seem to be superior according to these studies. Now, I mentioned before that I like to use it transcranially, on the head. And many people will say, well, if you've got something that's 405 nanometers or 635 nanometers, it's not going to penetrate as deep as an infrared or far infrared laser. Well, again, that may be true. What Erchonia did is they want to show that you could actually change brain function with these lasers. This is significant for an athlete because what's controlling your coordination? It's the cerebellum. What's controlling like your coordinated movements? You have all these different, like the motor strip. You've got the prefrontal cortex. All of these parts of the brain are firing to make an athlete perform better. And if we can enhance brain function, you can enhance their performance. Just think about how many times an athlete gets a concussion, goes back to their sport, and they're just not themselves for a while because the brain's not functioning right. So this was a study that Erchonia did with autistic kids, and they wanted to show that the laser did change brain function. And you see that at the top, that's before laser therapy. The red areas are areas of neuronal activation and blood flow. And the bottom is after laser therapy. And you can see there's a lot more areas of neuronal activation and blood flow, especially in the frontal lobe and in the cerebellum. So that was great for the autistic kids, but it also is great for your athletes because if you can improve blood flow and neuronal activity in those areas, you're going to enhance their sports performance. And when we look at how laser impacts the brain, you're going to see that laser is going to come in. And these are some of the things that you get with a low-powered laser. You get increased blood flow and cerebral oxygenation. You stimulate lymphatic drainage. So this is all good whether an athlete has a concussion or let's say you just want to enhance their performance. You decrease edema. You stimulate new blood vessel formation by angiogenesis. You dampen the neuron excitotoxicity. You dampen the inflammation in the cells. You stimulate neuron progenitor cells and neurotrophins like brain-derived neurotrophic factor and nerve growth factor as well. You start to increase the formation of new synapses through synaptogenesis. You increase the antioxidant levels in the brain, and you have anti-apoptosis and increased survivin as well. So these are great things that you get that improve this athlete's brain, which thereby will also improve their performance. So let's get into this. Let me show you now some of the case studies and some of the videos that I'm excited to share. So this is one of my baseball stars that I work with out here. This kid, he's in the picture on the right there. His name is Jason Gonzalez, and his team, Vanderbilt, they are the #1 college baseball team in our nation. They were our most recent national champion. And Jason would come in to see me regularly for sports performance. Here he is in my office after he won the national collegiate title, what we call our World Series. A little arrogant of us, I know, to call it the World Series champion, but that's what they call it out here. But anyway, he came in, he would get normal performance. And I just want to share with you his testimonial because he started working with me as a youth athlete. He's now finishing his final year in college, and he's probably going to go into the pro baseball arena as well because he's one of the top athletes in college baseball right now. Here's what he said. And it's a key thing. I've been treated for different injuries or simply for preventive maintenance and adjustment since my sophomore year at Bishop Amat High School with Dr. Gair. I'm now entering my junior year of college at Vanderbilt University, where I continue to play baseball. I've had from as simple as sore muscles to pulled and strained muscles. Dr. Gair has helped me heal so much faster with the laser treatments and protocols. This is his words, I am healing at least 50% quicker than I would be without the treatment. In studies will tell you it's at least 25 to 35% faster, but we usually see with athletes 50%, sometimes as much as 70%, even with broken bones. He says, I also come in to see him for preventive maintenance, tune-ups, and adjustments every time I come home from college. He says, I always like to have him treat the areas of constant use due to baseball. The tune-up treatments and adjustments help me perform better. Key thing. And they help me recover quicker. How many athletes can benefit from better performance and faster recovery? He says he's been referring any athlete to him that complains of any type of injury or just for tune-ups to improve their performance. And he says he has complete faith in what I do, and he's seen results from day one. And he says, I honestly wish I would have him with my teammates and I at Vanderbilt during baseball season, because even though we just won the College Baseball World Series, he would definitely take us to another level of play with his treatments. So this is key because he's at a top university with top treatments, but they don't have laser. So he actually, and many of the other athletes, will fly out to see me during their seasons to get laser therapy. So this is what it can do. What does it look like? So this is the FX635. This one's very, very easy to use. Here I'm treating a veterinarian who's got mid-back pain because he's 6'5" and does a lot of surgeries. So we simply put the laser on there and let the laser do the magic, and it rotates around. Now, if I'm doing an athlete for performance enhancement and they have no problems, I can actually rotate those diodes to where I have one rotating up near the head and the neck, one in the chest, and one down on the legs. What we get with that is you're going to stimulate that athlete to make ATP, which is your energy molecule in the mitochondria. You're going to make nitric oxide to dilate the blood vessels and improve blood flow. You're going to stimulate stem cells as well. And you're going to get a host of different benefits from that enhance their muscle mass by stimulating the stem cells, by also improving their blood flow and dampening the inflammation, which improves their performance. Now, many times people are skeptical of this being just a placebo. So I want to show you this little case study of an animal, which is the previous doctor. It's his patient. This dog, Lucky, was hit by a car and he came in paralyzed to Dr. Juan's office, and he has the same lasers at his office. And here's Lucky to where he can't even move at all. And so Dr. Casillas used these same Erchonia lasers, and he treated Lucky. He got them on them right off the bat. Lucky's owner thought he was going to have him put to sleep. Fortunately, you're going to see what happened with Lucky. So on the first day, here's Dr. Casillas using the class 2 Erchonia lasers. Cool thing is that the blink reflex is considered to be safe, so you don't have to put goggles on everybody. Here he is now doing a little chiropractic manipulation on the dog. I just want to kind of skip ahead because we don't have a lot of time. I want to show you here he's using some other tools, and then he went back and did more laser. This is over only 4 days that Lucky went from being paralyzed to look at Lucky 4 days later. Here's Lucky running, and Lucky got rehomed, and he was very lucky to see Dr. Casillas because he's having a happy, healthy life. So if you can do this with a dog who came in paralyzed, imagine what you can do with an athlete who's not paralyzed. So let's look at how do we actually do the treatments now. So if I'm going to do the basic brain protocol and I'm using the FX, or if I'm using the handhelds, I can just stick one on there too in a stand. A lot of times we just get the laser on there. Now I like to do some brain exercises. You can, let's say if you have an athlete who has some balance issues, you can stick them on a vibration plate while they're under the laser. So they're doing these proprioceptive balance exercises. Let's say if I've got an athlete who needs eye tracking coordination, like a lot of my baseball players, we'll put them under the laser and have them do just simple eye tracking exercises. You can do basic low-tech ones, or you can be high-tech with the screens that, like the right eye and left eye kind of screens on there. I like doing low-tech ones where we're just following the pen here and bringing it in here, or having them focus on a point and turn their head left and right while they're focusing while the laser is on their head. So the simple premise for improving brain function with an athlete, or with anybody really, is whatever they're weak at, you stick the laser on there and you have them do that activity while the laser's on their brain. Let's get in and see some videos here. This is an example of me working on a patient's neck with the FX. So it's very simple just to get it around that area. I'm going to have him take his baseball cap off here in a moment so we get better penetration. The laser will penetrate through the hair as well too. Clothing is going to block some of the laser, but you're still going to have a lot of the photons that will go through it. So I like to get the laser and surround the area. So whether this is an athlete who's got an injury or we're just trying to enhance his performance, I'm simply palpating there to see what areas are tight or tender. And then I like to come around and use this other device, just a little therapy device. You can use your hands, you can use any kind of scraping devices, but I'll use these type of muscle devices at the same time as the laser. The reason I do that is because with your therapy tools, you can break down some of the adhesions that are in there. And meanwhile, the laser is stimulating stem cell production to help you to make new healthy tissue. So, and you can do this anywhere. We can come around and we can work on the front. I want to skip ahead here to show you like working on the shoulder. So here we can come in. I can get in there, I can work on the shoulder while the laser's on there. So while I'm doing some myofascial release, I've also got the lasers on there affecting him transcranially and affecting on those muscles to stimulate some stem cells. So again, I want to skip through this video. If you guys want to see the full videos, I can make sure those are available to you. I'll send them over to your UK reps as well, so you can watch these at your leisure later to see the whole thing. This is here's the real secret to getting athletes to perform better. So it's a little more advanced technique. It's a simple premise though. We're going to test some specific muscles. We're looking for muscles that are weak or a little shaky. If that muscle is weak or shaky, we're going to simply laser over either the muscle or over, if it's the upper extremity, over the cervical nerve roots. If it's the lower extremity, you'll see that video in a little bit. We're going to laser over the abdomen and over those muscles down there too. So I just want to show you, this is with the neck. Let's see, I've got an athlete coming in with a tight neck. Here's what we're going to do. Let me just mute this. So I'm going to skip ahead here. I'm going to find a strong muscle here for him. Let me skip here. So here, we're going to bring this muscle up, an abductor muscle. I'm having him push up. It's nice and strong. Now, I want him to tilt his head forward to see how forward flexion affects his muscle. And you see how it makes it go weak. So in this position as an athlete, anytime he'd be looking down, he would have decreased athletic performance. I'm simply going to laser over his neck from the occiput down to C7 for about 5 to 10 seconds. I simply want to try to activate this pathway, and I'm going to have him retest it and push up, and it's strong. So now what we're going to do is we're going to do another range of motion. We're having him tilt his head back, and in that position, he's weak also. So now I'm just going to laser over the neck and for about 5 to 10 seconds, and then I'm going to retest that muscle to see if it's strengthened up or not. And so we did that time there. He's going to bring it back up. He's pushing up. It's now strong. So now I'm going to have him turn his head. Boom, he's weak. So anytime he's in his athletic endeavor and he's turning his head, he's going weak. We don't want that to happen. So I'm going to laser him while he holds that weak position. Bring the arm back up. Retest it. It's strong. So I'm going to move on to another motion. Having him turn his head. You see, boom, it's weak. We're going to go in there. We're going to laser. You see, I'm going from the occiput down to C7. And I'm going to have him push up. And it's strong again. So now we're going to have him tilt his head to one side. He's going to push up. And that's weak as well. And you see his back also gave out. So we're going to laser in that weak position until it strengthens. We do about 5 to 10 seconds. It's now strong. We tilt his head here. Push up. It's weak. His back gave out as well too. Watch, I'm going to show you again where not only does his arm give out, but his back leans over as well. Boom, that gives out. So here I'm going to go and I'm going to laser that area of the neck. And then I'm going to do about 5 to 10 seconds and retest. And it's strong. Well, it's still weak in that case. So I'm going to do it a little longer. So anytime if it's weak, I'll laser a little longer until I can get that muscle to strengthen up. And as long as you don't have something major like a big disc herniation, this, for most things that you can do with athletes, will strengthen them up. So let's go on and show you another little video here. This one, oh, I think that repeated that. So let me go to this next one. What about shoulders? Shoulders are really common. Here's a case study where a patient had multiple tears. I just want to show you this because here's his MRI. In this MRI, he had full thickness tears of the infraspinatus tendon, the supraspinatus tendon, and a partial tear of the biceps. And with doing the laser, we were able to actually repair those tears and help him to avoid surgery. Same thing happened with this kid. This kid here was a high school athlete. He was recommended for surgery. We got the laser on him. We did it 3 times a week. I would laser over him. You might want to take a picture of this or a screenshot. I would laser him on these settings of 4, 9, 33, and 60 on the neck, and then put the laser over the injury area of the injury. And we got that tissue to repair. This kid never had to have surgery, and his team went on to win a conference championship as well. But I want to show you the video what this looks like. So here we have it. This is going to be a video of me treating the shoulder. I want to skip ahead to the shoulder though here. So let me show you this. So here we're going to test some muscles. So here I'm testing his biceps, and that's strong. So there's nothing to do there. So now I'm going to go down. I'm going to test his triceps. So I'm going to have him push down. He's pushing down here, and he's pretty good, but he's got just a little kind of a shake to it. So all I'm going to do here is I'm going to laser over the muscle that's weak until I can get this to strengthen up, and this will enhance his performance. So there, we got that to be a little stronger. And then I'm going to show you what we're going to do with the next muscles. We're going to bring him up, and we're going to do ones for the shoulder. So anytime you have a shoulder injury, I'll bring him up. I'll test the anterior deltoid. So he's going to push up here. And he's pushing up, and there it is. It's weak. And I always ask him, is that just weak or is it painful? In him, it was not painful. It was just weak. So I can either laser the neck or I can laser the deltoid. Usually about 5 to 10 seconds. It will activate that communication between the cerebellum and the muscle, and boom, now we've got that thing activated. And then here, we're going to test this middle deltoid. Push up, and he's weak. We did this one before we did the neck. So he was weak here. So now we're going to go here and we're going to try to strengthen it up. And he's still weak, so we need to do a little longer. Now I'm lasering directly over the deltoid. And we push up there until he gets strong. And now he's finally strong. So that's the basic premise with doing these shoulder type of exercises. You're going to go through and you can test each muscle. If you need to, you can go into the hand, you can go into the wrist, but usually for a shoulder to enhance like let's say if I have a throwing athlete or someone who's playing basketball and they need to shoot really well, let's say they got a shoulder strain or their shot is off, we'll do transcranial, we'll do the head movements so they're functioning better, and then we'll go in there, we'll test the biceps, the triceps, the deltoids. You can test the pecs, the middle deltoids here. You could go into whatever deep detail you want. The basic premise is whenever a muscle is weak, you either laser the muscle or laser the neck. Now here I'm doing it statically, but you can also, if he's got a weak biceps, I could put the laser on the biceps and have him do biceps exercises. If it's the deltoid, I can have him do deltoid exercises here or here while the laser's on him. So that's a simple premise. Whatever they're weak at, you have them do it while the laser's on there. The final case I want to show you here, this one wraps everything else. I know many times, when we treat athletes, we sometimes have, injuries where we can't fix them without surgery. So, well, what do you do in a case like this? Well, this was one of my athletes who had what was considered a death sentence, to where she tore her MCL, ACL, and her meniscus, and she was told she was going to need surgery and she would be out for a minimum of 9 to 12 months. Well, with what I did here with this protocol, we got her back in just 4 short months, to where her surgeon was shocked. All of the physical therapists were shocked as well, because no athlete had ever recovered from this surgery with this particular surgeon any faster than 9 months. And we got her done in 4 months, and she went on to win a conference championship and to go on to wrestle in college as well. So what did we do with this girl? Well, here's what we did. And again, if you want to take a picture of this, feel free to do it. Anytime I have a patient who's going to go in for surgery, we do these pre-surgical protocols. And with this will help them to recover faster from their surgery. I'll simply get the laser on the area with her. It was the knee. We did it on these settings of 8, 25, 42, and 125 hertz for 5 to 6 minutes. We did that 2 to 3 times a week for 2 weeks before she went in for surgery. As soon as she was out from the surgery, we did the post-surgical protocols. And again, it was 3 times a week. We used the same settings for these acute injuries, 8, 25, 42, and 125. We did it over the knee. The laser also helps the surgical incision to heal faster. I used the combination of the red and the violet lasers on her. And then protocol 3, this is where we do our rehab, our enhanced rehab, which is also for performance enhancement. So what I did is, when she could move her knee more, is we went through and we did the laser while we had her doing knee movements, while we had her doing resistance exercises, and we would activate specific muscles and then do soft tissue therapies while we had the laser on her. So I want to show you what this looks like of actually doing this knee activation on here. It's very easy to do. It just takes a little time to get proficient at. Again, the basic premise, let me mute this over here. We're going to go through and test the primary movers of the lower extremity, the quadriceps, the hip flexors, the hamstrings, etc. We're going to test those muscles. We're going to look for a muscle that's either weak, shaky, or painful. And so he's going to come up here. I'm going to test him. He's going to push up into my resistance. I'm going to have him push up. He pushes up, and it's weak. And I always ask him, is that just weak or is it also painful? With him, it's just weak. So now what we're going to do is we're just going to take the laser and we're going to laser over either the abdomen or over the muscle. And, yes, again, the clothing will block some of the laser photons, but you can get enough of the photons to go through there to get a change in their function. It's always best if you can get more, laser directly on the skin. But in some cases, if you have to go through some clothing, you can still get some impact. Now here I'm having him actively move that muscle until I get it to strengthen up. So we did that for about 10 seconds. He pushes up. It's now totally strong. So now I'm going to test his quadriceps and have him push up toward the ceiling. He pushes up, and it's just a little shaky, a little give. He has no pain. So again, we're not looking at pain. If he's an athlete going to go do sports, it's not that pain is his problem here. Here it's just a little weak. So if he's running or jumping, he's not going to do that as efficiently. So here I've got the laser on his muscles while I have him keep pushing up until I feel like the resistance is stronger. Then boom, there the resistance is nice and strong. So we're going to move down and we're going to do his hamstrings. and boom, it's nice and strong. So there's nothing to do there, but if it was weak, I would just laser the hamstrings, have him activate the muscle, or I can laser over the abdomen and have him activate the muscle and push down until we get that to strengthen up. And then here, we can straighten it out here and test another muscle. I'm having him push up here. That's also weak. That one had a little bit of pain for him. So here I can just laser over that whole muscle. I can either go to the abdomen. If it wasn't on a video, I would have him lift up his shirt so I can get it on the skin. But we can laser there for argument's sake. I was doing it through the clothing. And here, let's bring it up and basically see, did we change his muscle strength or not? And boom, we did. We changed the muscle strength. And now we can also test his gluteals, his abductors. This is what I did on Zach to enhance his performance and help him to win those world records. So again, we're just going to the main muscles here. I'm having him push up. That's nice and strong, so there's nothing to do there. If it were weak, I would laser over that muscle or laser over the abdomen. Now I'm going to test him for his abductors moving out. So with patients who have balance issues, this is a really good one. Hold the leg out, rotate it in, and try to push it towards the other foot. He's going to try to push out towards me. You see it's weak. So now I can either laser over his abdomen, laser over the muscle. You ought to also watch out. A lot of times patients will try to rotate their foot out to cheat. But so here I'm just going to laser over the abductor muscles because they're very weak. So I take that laser and put it on there. And then I can have him activate the muscle and push out towards me. And he's going to push out. And I'm going to have him do that until it goes strong. Now, if you don't want to do the muscle testing, you don't have to. It's just this really reinforces to your athlete that you just changed their function. I always like to have them do a squat and a lunge beforehand and then squat and lunge after I do this, because then they can really feel the difference in what their function was, to where it's easier, it's smoother, they can do it a lot easier. So if you can do it this method, or you could simply stick the lasers over that muscle and have them activate it, and that's going to give you performance enhancement. So if you got an athlete who needs to throw, then you just put the lasers around the shoulder and have them do a throwing motion while they're doing it. I like to not only get one on that area, but also on the brain. So now we're lasering the brain while the cerebellum and the motor strip's being activated, and over that muscle that's being activated. So that is basically the way I do the performance enhancement for athletes. So at this time, I'm going to turn it back over and see if you have any questions here at all from me. I'm going to stop sharing my screen.
Well done.
Okay,
Really
Chanel, I
informative.
think I can't hear you at all, but
Oh, shucks.
I'm kind of wrapped up there. What I'll do is I'll go out and come back in real quick.
Perfect. No problem. Alrighty, we'll wait for Kirk to get back. We did have some technical difficulties setting up. He'll be back with us shortly. If you have any questions, please feel free to send them through to us now, and we'll ask Kirk. There he is.
Right.
He's back with us. Hi, Kirk. Welcome back.
Thank you.
Alrighty. So, I mean, as a chiropractor myself, with my fixed qualification, I found your presentation extremely stimulating and really interesting.
Cool. Thank you.
I worked myself in a practice that had low light laser therapy, but it wasn't one that you have kind of introduced me to this evening, and I found it really, really informative. I have a question, and then we can kind of wrap up and thank you guys and the sponsors for really empowering us with this type of knowledge. The type of low light laser therapy that I've been exposed to before takes quite a lot longer to have the same type of impact. Is there a specific reason why this laser can be held over that targeted area for such a short period of time and be so effective?
Yeah, particularly if you're using a light therapy like an LED device versus a laser. With this being a true laser, coherent beam, we're affecting communication pathways as well too. So that's one of the reasons why it's so different from, let's say, something else that's, say, an LED. We're just getting a different biostimulatory effect, and also a kind of like an electromagnetic effect on that area too. So that's one of the reasons why it works so efficiently on there. And I always like to use what's the least amount of time we can do to achieve a result. And you see that, 5 to 10 seconds, boom, we see that change very, very quickly. And a lot of it too is because we're using those wavelengths that the body is really, really receptive to, the visible spectrum, using 635 nanometers or using 405 nanometers. That's where the body really is good at absorbing those wavelengths.
Okay. So when you kind of ran through your protocol and you're doing a lot of muscle testing, does that mean you've already eliminated the nerve roots type of stimulation that would cause that type of weakness? How would you decide between
Yeah.
activating with the laser over the nerve roots versus purely relying on a muscle kind of testing basis? That was really
Yeah.
interesting to me.
What I love about this method is I actually use this as a screening method, because
Okay.
regardless of what I think is going on, let's say even if I think, oh, there may be a disc herniation, with a nerve root, let's still go with this and see what we can clear out. Because then let's say if I do this and I can't strengthen it, then now I know, okay, there's probably something more going on. Let's now send out for an MRI. So instead of wasting, say, 2 weeks of therapy, of doing conservative therapies, thinking, well, this might be something, but let's try this first and not get anywhere, I know what I should be able to do in one session. If I can't get it, then I can already go, okay, I need to order some imaging studies right off the bat, because it'll give me an idea that's going on, or if there's some major tears, labral tears, muscle tears, etc.
Okay, so this isn't only part of your treatment protocol, it's also a diagnostic tool for
It
you,
is.
which is very, very cool.
Yeah,
Okay.
yeah. So like I'll start, if it's a shoulder, I'll have them go through ranges of motion. I really skip some of the ortho test and go straight to this muscle testing, because it gives me a lot more validity of what I need to do. And then I can see how much they improve and then figure out where I need to go to next. And it saves the athletes a ton of time too.
Phenomenal.
Yeah.
Amazing. Very
There's
cool.
a great question here too from Simon, if I can answer it. So he asked about concussions for athletes. Yes, the laser works great for concussions. I do this all the time with them, and also for people who have, I'd say chronic traumatic encephalopathy, where they've got dementia from these concussions. It works great for that too. Obviously, the earlier you can get it on them, the better. I played 11 years of American football out here, had numerous concussions. When I was in my 30s, it was affecting me. I was having some of the symptoms of chronic traumatic encephalopathy. So I've used the lasers on myself to actually help with that. And my brain right now at 51 is working better than it was in my 20s and in my 30s. And it's really thanks to the lasers.
Phenomenal. There's also one more question here,
Sure.
Kirk.
Mm-hmm.
There are a lot of ex-pro football players who are getting
Yep.
dementia later in life,
Mm-hmm.
obviously related to high impact.
Mm-hmm.
And they're saying this could be due to hitting the ball
Right.
repetitively, that type of
Right.
impact. Could the non-thermal laser be helpful with that?
Yeah, absolutely. And this is something where, for those of you who are on here watching this, who work with teams, it's something I would recommend that's done regularly on those athletes. You want to do it preventatively in a sense, because as you saw from that concussion slide earlier, or the brain slide, all the things the laser does, not only for concussions, but also to enhance repair of the brain. With my athletes, I do brain treatments on them every time they're in my office. So I don't wait for them to get a concussion, but even if you got them later in life, you still, can do things to reverse what's going on. How much can you reverse? It really depends on the damage that's there. But I've seen really good results with people who are in pretty bad shape, even people who were suicidal from the damage.
Phenomenal. Amazing. All right. So with that being said, thank you for your time and your expertise.
All right, great.
And thank you
Thank
to
you.
our sponsor, Erchonia. Yes?
Erchonia.
Erchonia.
Yeah, that's right.
So thank you so much to everybody there, and we look forward to hearing more from you. So if anyone is looking for more information from either you or Erchonia, where can they find you guys?
They can email me at Dr. Gair, that's DRGAIR, at Gmail, if they want a copy of these slides from today. I'll send them over to them. I also have a Facebook group that they're welcome to join. It's called Dr. Gair's Laser Therapy and Marketing Secrets. And it's on Facebook. It's free to join. We have doctors from around the world in there. We all share different protocol tips. And also many people have family in other states, other countries. And so it's a good referral network too. And so it's just Dr. Gair's Laser Therapy, Treatment, and Marketing Secrets.
Wonderful. Thank you so much, Kirk. Thank you, Erchonia, and we look forward to hearing more from you.
And real quick too, the Erchonia website is erchonia.com, ERCHONIA.com.
Wonderful. That's on the bottom of the live stream, so you can check it out there.
Great. Thank you.
Guys. Thanks.
Have a great day. Bye-bye.
Bye.